Bismillah Rahman Rahim. Assalamu alaikum. Breathing, it's something we rarely think about. Have you ever felt out of breath after climbing stairs or walking a short distance? Imagine waking up every day feeling like you can't catch your breath. For millions of people, that's not just a one time thing. Every breath is a challenge for them. It's a condition called COPD, chronic obstructive pulmonary disease. For people with COPD, this is their daily reality. In today's vlog, we are breaking down what COPD is, its warning signs, and how to take control of your health before it's too late. Stay with me. This is a conversation we all need to have. COPD affects millions of people globally, but with early detection and the right care, it is manageable. Let's raise awareness and break the stigma around this condition. In today's vlog, we shall explore what COPD is, its causes, symptoms, and most importantly, how we can prevent and manage it. Stick around, you will learn something that could change lives. Meet Ahmed, a 55 years old construction worker who has been smoking since his teenage years. For years, Ahmed brushed off his persistent cough as just a smoker's cough. But lately, even walking short distance leaves him out of breath. Ahmed noticed he had frequent chest infections, wheezing, and fatigue that worsened over time. He could not climb stairs without stopping to catch his breath. He started avoiding family gatherings because even talking for long left him gasping. Ahmed's long history of smoking and working in dusty environments increased his risk for COPD. Unfortunately, like many others, he ignored the early signs, thinking it was just part of getting older. After a particularly bad episode of breathlessness, Ahmed visited his doctor. A lung function test called spirometry confirmed the diagnosis: chronic obstructive pulmonary disease or COPD. With the right treatment plan, Ahmed started to take control of his condition. He quit smoking, used prescribed inhalers to improve his breathing, and joined a pulmonary rehabilitation program to strengthen his lungs and body. Today, Ahmed is learning to live better with COPD. Ahmed's story is a reminder that COPD does not happen overnight. It develops over years, often silently. Recognizing the early signs and seeking help can make all the difference. Key takeaways from this case history. What are the symptoms to watch for? These are persistent cough, breathlessness, frequent chest infections, and fatigue. What are the risk factors to develop COPD? These include smoking, exposure to dust, pollution, or harmful fumes. Why it is important to diagnose early? And what are the means to diagnose COPD early? It's a test spirometry. It's a simple test that can detect COPD early. So when you go to your doctor, he will do spirometry for you and can confirm or exclude COPD in your case. What are the management tips? These include quit smoking, use inhalers as prescribed, stay active, and avoid respiratory irritants. Do you or someone you know have symptoms like Ahmed's? If yes, don't wait. Early diagnosis and lifestyle changes can slow the progression of COPD. Please share this video to spread awareness, and remember, every breath counts. Let's discuss few important medical aspects of COPD in the learning sequence. Chronic obstructive pulmonary disease or COPD is a progressive lung disease characterized by chronic inflammation and airflow limitation. What are the types of COPD? There are mainly three types of COPD. One is chronic bronchitis, which means inflammation of bronchial tubes. Second is emphysema, which means damage to alveoli or air sacs. And the third is refractory asthma, which is severe irreversible asthma. What are the causes and risk factors for COPD? These include smoking, and this is a primary risk factor. Air pollution, Occupational exposures like dust, chemicals, genetics play a role, repeated respiratory infections, age, the risk of COPD increases after 45 years of age, and family history. What are the symptoms of COPD? These include shortness of breath, which is called dyspnea, wheezing, noisy chest, coughing with or without mucus, chest tightness, blue lips or fingers in severe case. There are four stages of COPD: mild, moderate, severe, and very severe. And the severity is determined with the help of the spirometry. There is one value which is called FEV1. When it is more than 80%, it's a mild COPD. When it is between 50 and 79%, this is moderate COPD. And when it is between 30 and 49%, this is severe. And when it is less than 30% predicted, this is very severe COPD. The doctor will tell you that in which stage you lie. How we diagnose COPD? Of course, the spirometry, the lung function test is the primary investigations. Chest X-ray, CT scan, arterial blood gases, and medical history and physical examination. All these are the means to diagnose COPD. What about treatment? It includes medications, drugs, lifestyle changes, and surgical options. The drugs include bronchodilators in the form of inhalers, corticosteroids, it may be in the form of inhalers or oral tablets, then phosphodiesterase 4 inhibitors and mucolytics. It's the doctor who will prescribe for you which type of drug you need to control your COPD. Then lifestyle changes, and these include quit smoking, exercise regularly, you should take the healthy diet, you should work on stress reduction, and of course pulmonary rehabilitation. There are surgical options for COPD as well, and these are the in advanced cases or in advanced countries, it's a lung transplantation. Then bulectomy, removing the damaged lung tissue, is another surgical option in selected cases, and lung volume reduction surgery. COPD is associated with a lot of complications, and the main complications are respiratory failure, heart failure, which is called carpulmonale, pneumonia, malnutrition, and of course, depression. So remember, COPD is a serious but manageable condition. Early diagnosis, quitting smoking, avoiding triggers, and following the right treatment plan can make all the difference. COPD does not have to define your life. With awareness, action, and support, you can take control and breathe easier every day. If you or someone you know is living with COPD, share your experiences in the comments below. Let's create a community of support and awareness. Every breath matters. Let's protect it together. COPD awareness saves lives. Start the conversation today. Remember, COPD might start silently, but with awareness, it does not have to go unnoticed. Together, we can educate, empower, and encourage early action. Thanks for joining me today. Don't forget to share this video to help spread awareness. Until next time, stay healthy, stay informed, and remember every breath counts. Khuda Hafiz.